Dr. Jennifer Ashton, thanks for joining us tonight. Let's start off by talking about where we stand right now. In several states, the number of coronavirus cases is going up, and Dr. Anthony Fauci says we're still knee-deep in the first wave. It's hard to believe we're still in the first wave. Is all of this because of the reopening process that took place across the country?
Well, I don't think anyone knows for sure. Remember, we're only months into this pandemic, only 6 months into our relationship with this virus, and we've never been in this situation before. A lot of this assessment based on statistics and numbers and analytics will be made in retrospect after it's in the rearview mirror and we're moving on in time. But I think certainly the factors that are involved are not just the reopening and social behaviors, but it's also this virus that has been shown to be highly transmissible. And as we learn more and more about it, it becomes more elusive and more challenging to contain in the traditional ways that infectious disease specialists normally try to contain an outbreak like this.
Sure. Well, let's talk about the death rate. The number of cases is going up in some areas, but some say that the number of deaths from that virus is actually going down. Is that true?
Well, I think right now it is. We have to remember two things. Number one, deaths always lag well behind hospitalizations, which lag behind confirmed cases. So, while the smaller percentage of people infected with COVID-19, SARS-CoV-2, go on to require ICU care and then unfortunately succumb to the disease, that's not something that happens overnight. These are patients who are critically ill who can spend weeks in the ICU before they die and then before we record that unfortunate statistic. So lag time is a factor. The other thing that's a factor is, I think, intensivists, critical care specialists, all the doctors, nurses, respiratory therapists that care for these critically ill patients have gotten up to speed in record time with the unique features of this virus and how it causes disease. And so the clinical care, I think, has improved. And lastly, I think we're seeing it affect younger populations, which, if there's any silver lining, that in general, they're at lower risk of severe disease and death. That does not mean zero risk, however. So I think it's probably a combination of all those things.
Well, here in our area, some bars and restaurants and even a hair salon that reopened have all closed again for a deep cleaning because someone there has tested positive. Do you think we're going to be seeing a lot of this opening and then closing and then opening again?
Well, first of all, in my job, I'm speaking to public health officials and infectious disease specialists, and I'm in touch with Dr. Anthony Fauci on a regular basis. And no one can really look into a crystal ball, because there's none, and forecast what we're going to be like in a month or in 2 months or even in 6 months. But I think the question is not whether there will be more cases in the future. There will be. The virus has not gone anywhere. It hasn't gone on summer vacation. The question is really how we'll respond to those cases, how we will manage them, and manage living with the virus rather than having it manage us. So whether we'll see sporadic closures or step back in terms of phases of reopening, I think that will be determined on a local, case-by-case basis almost. But I think the sooner we realize that we have to learn how to manage this rather than have it manage us, the better we'll be.
What is the most dangerous thing you're concerned about people doing right now, and how can we protect ourselves?
Well, I think by far the most dangerous thing is to not heed those 3 very important steps of hand hygiene, keeping at least 6 feet apart or distancing from large groups or crowded areas, and wearing a mask or face covering. That's new for us. That's new science. That's new evolving data that suggests how important it can be in slowing the spread of this virus. But if people don't get on board with that, we will not be able to stay open, because our hospitals will become inundated and over capacity. And once that happens, I think local leaders will have no choice but to step back, because we can't have hospitals that don't have any ICU beds. It puts everyone at risk.
Sure. Well, it's warmer outside now, and many people are thinking about taking a family trip out of town. What do you think? Is it safe to take a summer vacation?
Well, as you know, I'm not in the travel business. I'm a doctor, so I like to stay in my lane. I think summer vacations will look different for a lot of people. It might be more camping trips or less crowded places, more outdoor activities, really in nature versus crowded touristy kind of things. But people have to, weigh their own risk and identify their own situation, their own personal factors, and then decide for themselves. But I think that people wish it looked like last summer, but unfortunately, that's not our reality at this point.
Right. And one of the big unknowns right now is school. Districts all across the country are trying to decide right now how to handle the next school year. What do you think that things might look like when those school bells ring again?
Well, I mean, first of all, as a mother, I think going back to school is critically important. And I think it has to be looked at in various age groups because the decisions made for elementary school or grade school children will likely look different than those made for college age students who have to live on campuses. So I think that there are a lot of smart people weighing the risks and benefits and trying to lower risk as low as possible. But my message to parents, and this is how I'm looking at it as a mother and a doctor, is that you can't remove all risk. We can't put our children in a sterile environment or have them live their lives in a plastic bubble. But we have to understand that this virus, while it doesn't particularly affect with severity the pediatric population or age group, they can come home and spread it to parents, grandparents, relatives who have a slew of underlying medical conditions who could be at serious risk. So it's not just about the students, but the faculty, the staff, the people that are touched by this in kind of a ripple effect. And I think, again, just like you asked me earlier, it's not a matter of if there will be cases, it's a matter of when, how many, and how the school environment will respond to that. And I think having a plan in place will be the key to that.
Well, Dr. Ashton, we ask our viewers to send us questions that they have for you. And the number one question we got is, are there any vitamins or supplements that you would recommend that we take to help prevent us from getting sick?
Well, it sounds like your viewers know that I also have a degree in nutrition, which I got in the last 5 years because I felt so it's really not taught in medical school. But nutrition is very important. Right now, there are clinical trials looking certain supplements like vitamin D, zinc, vitamin C, in reducing the risk of getting sick with COVID-19. There are no official recommendations for that. And when you talk about supplements, more is not better. There can definitely be harms with too many of any kind of supplement. So for right now, the recommendation is to eat as well as you can. If you think you have a deficiency in a vitamin, let's say vitamin D3, which is known to affect the immune system and in particular have an association with respiratory viral infections, get your blood tested to find out what your level is. And then the recommendation for the average American for vitamin D3 is no more than 4,000 units a day. So again, you have to weigh whether you're at risk, what the possible benefits may be, but right now there is no official recommendation about any supplements preventing COVID-19.
I wanted to ask you too, when I go out, I see a lot of people wearing a mask, but I also see a lot of other people not wearing a mask. Should we be wearing one now, and why?
No question. And right now we have to remember, this is new for us. This is for our society. This is new for our country. The science is evolving. 3.5 months ago, what has not changed is our recommendation masks go on sick people to help block the spread of their infection to others. That hasn't changed. The assumption now is that because so many people can be infected with COVID-19, show no symptoms, that we all have to assume that we may be infected or sick. Doing that service as social responsibility for others is one of the only things we can do right now. So everyone has evolved their thinking on this. We have to maintain the ability to adapt and pivot and respond accordingly, especially when we're facing a public health crisis like this.
Sure. Is there a lot we still need to learn about this virus?
Absolutely, there is. I mean, we have to remember some people study a particular virus for 50 or 60 years and don't even come close to learning everything there is to know about that virus. Anyone, any scientist, any PhD, any MD who has dedicated their life to studying infectious diseases could tell you that. We've only known about this virus for about 6 months. So we are learning every day. And unfortunately, that can appear confusing and in some cases stressful for people to hear. One day we didn't think this, now we do. But in science and medicine, you have to have an open mind because we are always reassessing what we think we know. And really, to have intellectual integrity, scientific and medical integrity, you have to be open and recognize what you know, what you don't know, even what you don't know that you don't know. And this virus is showing us that every single day.
And Dr. Ashton, my final question for you tonight. What is something you've seen that has surprised you the most during this pandemic?
Oh, I think it's the what we call pathophysiology of this virus. It behaves in a way that is unique and perplexing that we have really not seen in medicine. It gives this picture of both infection, inflammation, a clotting disorder. It affects oxygenation in a way that's really atypical and unusual for viral pneumonias. And these patients, when or if they need ICU care, according to some of my closest friends and relatives who have taken care of them in an ICU setting, they are sick patients. They're challenging to treat, and they present very differently than patients, let's say, with influenza pneumonia. So there's some really quirky features about this virus that are still mysterious 6 months in, for sure.
All right. Dr. Jennifer Ashton, thank you so much for taking the time to talk to us tonight. I appreciate it.
Thanks for having me.